I'm Sally, I'm our Chief Commercial Officer here at PKB, and I'm joined by Pam and Emily, who are the let introduce themselves. They are the stars of our show, and we'll tell you all about some of their exciting programmes. So, ladies, would you like to introduce yourselves?
Yeah, hello everyone. It's Tester, I'm excited. So my name's Pam, I work at the Midlands Partnership Foundation Trust. My role is ICS and PCN Digital Transformation Programme Lead, so I've been working in terms of like deploying patient nurse gaps across our organisation. My role looks at digital transformation across the region, representing MPFT, but looking at how we partner with the acute trust, social care, and really thinking about that patient journey across the care settings.
Hi everyone, I'm Emily Birch. I'm the Chief Nursing Information Officer for the North London NHS Foundation Trust. We're a mental health trust in North London, recently merged, so we cover Barnet, Enfield, Harrogate, Camden and Islington, so quite a large geography. And we have been working with Patient Knows Best now for a year and a half, and always delighted to sort of say we were the first and still the only NHS organisation to have been able to deploy a patient filter to children and young people. And I have a contingent of our CAMS nurses here today.
Thank you very much for that overview. It'd be really helpful. I know you've been a little bit about your roles. It'd be really great if you could start, I guess, with what you were hoping to achieve when you procured PKB, now that we're a little bit further down the road, what you feel has been achieved so far, some of the outcomes, what you're excited about. Just a bit of an overview of your programme with us.
Yeah, so Midlands Partnership Trust is a mental health trust, but it also serves community. And we took this portal on as part of our community mental health transformation programme. And it's been absolutely brilliant, like working with you guys as a provider. We actually feel like you're part of the team, which is fantastic. Like a project manager just literally fits in with our team, which feels fantastic. And part of it was looking at transforming community mental health and digitalising the care plan and making it accessible for our service users and our patients. And as part of that, we wanted them to have access and the ability to contribute to their patient-reported outcome measures, and they're about me. And this needed to meet compliance with something known as PRSB, which is Professional Records Body Standard. That means structuring the data in a certain way that it can flow across different systems. So we are one of the first organisations, one of the first mental health trusts to reach level 2 conformance. And that has been enabled by the digital solutions that we provide. So by having the About Me and presenting that in Patient Knows Best and having the care plan, we are continuing to kind of like deploy this. So we've done it in a pilot way. We're community mental health first. We didn't just do trust-wide. So we really wanted stuff in there that was going to be meaningful and have patients really interacting with it. So we've got appointments, we've got letters, we've got questionnaires, we've got care plans, and we also did a piece around making every contact count. So every time a patient portal's used, making people think about their behaviour changes and how can they manage their own healthcare at home. It's been really brilliant, and now we've kind of like moved into our physical health services with MSK. And we're also looking at sort of like combining it with our hybrid mail solution, so that when patients are reading those letters within a certain time period, those letters are not being posted out, which is leading to cost saving for the trust. So we're getting cash releasing benefits because we're not having to physically send out that letter, and that then means we can obviously like continue to invest in the solutions that are really making a difference to our staff and our service users. And I'm just really, really excited with what else we can do with this.
I mean, I would echo the comments around Patient Knows Best and the team sort of becoming part of your team. We meet with them still every week, and we have done for the last year and a half. And the innovation and the want to work with you to deliver something that is meaningful to your services and your patients is really important. So we started this journey, and we're still on this transformation journey. We did start with our children and young adults. So we recognise that there is a massive challenge around appointments and DNAs, and actually the children and young people getting their data and their information in their own hands and sort of enabling them to make decisions about their care. So we started first with appointments and letters, which went well, but then we quickly expanded to further documents. And I'm going to hate myself if I get this wrong as I'm sat in front of our CAMS nurses, but we now include care plans, safety plans, and also gene family tree work, so they're able to do their genealogy and family tree work through PKB, which is really transformational. Part of the brilliance of this is that it's been driven by our service users. So before we did any kind of deployment or any kind of work, we extensively did patient engagement sessions, and we have something called a youth council, which is run by service users in our children and young services, young people services, and they sign off on what we do. So we've gone to them, we've shown them what we're doing, they sign off, they've given us some really incredible feedback that we've given back to PKB around what they want differently, and they're so excited about actually using a portal and having that in a way that they're used to managing other kind of information and technology. We're in our adult services now as well, and again, first tackling the challenge around appointments and DNAs. That's a big factor for us. Are we getting the information to our patients in a timely way so that if they need to reschedule or cancel, they've got that opportunity? We don't want letters getting lost, we want the information in their hands. And I think the exciting bit for next steps is working on CROMs and similar work to what you're doing with our psychology team, and they are incredibly excited about how they can sort of start reaching out and having those outcome measures come back, how they can get some tangible data coming back from these outcome measures so that they can target treatment more effectively and in a quicker way.
Well, that was fabulous. You've just answered about 4 of my next questions in terms of what your favourite things are about the platform and what you've implemented and what you're most excited about next. So thank you. You've made that really easy. In terms of advice to some of our audience that might be thinking about programs like this, what strategies do you think have made the work you've done today so successful? And as you move into your next phases, what are you going to try and really double down on, do more of to continue that success that you've had?
Yeah, really good question. I think just before we move on to that question, I think one of the key things here with Emily is one of the next phases that we're looking to go into is children's services. They're looking at patient reported outcome measures. So it's like really swapping and sharing that journey. And I think having you guys as a supplier and kind of making those links has been really easy in terms of like learning as well from each other's deployments, so that you kind of feel like you've got someone else to kind of share ideas with. And we've just said now we're going to grab a coffee after this and share some ideas. So in terms of strategy, our strategy, I think that's really informed it is like the national strategy, but we also have our MPFT digital strategy. And part of that was looking at kind of giving patients access to their care records, and then also diverting care to be more suitable for patients in the comfort of their own phones. So working with this now, I think the next steps that we're really excited about is how can we use this and start to combine it with wearable technology? How can we start looking at the next steps, test results from the acute care, and actually, because we've got it here within our organisation, but how about the other organisations in neighbouring trusts? Because what we found with our acute trusts that are also using this, it's been a real advantage by having the same patient portal. So our patients have that same kind of like experience. But to kind of like take it to the next levels is like looking at wearable devices, looking at how we can do more of that remote monitoring within the home as well. And then the other part is that integration with our core EPR system. So having that information coming back and our clinicians being able to access it, and then actually our patients having data like their care plans, but actually what more can we put in there that's going to make it more usable? So with our strategy, we started off doing pilots, and where we're seeing successes, we really want to level it up now. We want to go and deploy it across all services. And what we're finding is that our staff, they've seen it launched and they've seen, wow, this is really effective. We've got a queue now, everybody wants to have the patient portal. They're super excited. They're like, Pam, how do we get onto it? How can we get our service engaged? They're super excited about it. I feel like the next step is like really just working out a strategy of how we can have it across the organisation. And there are some precursors. So like one of the things is like having the infrastructure that's correct, because we want it to be a really good, and that's to do with our own internal things. But one of the good things about before we even started with the patient portal was before they took any mini offers, they made sure that we had things like IG sorted. And I think that's really good as a supplier, because they made us think about those difficult things, having the integration, those pieces done uphand, which then made the transformation and the deployment of PKB really easy. So the future for us is really looking at how we level it up, how we integrate with wearable devices, and how we integrate with other care providers, and look at their sort of strategy in terms of what patient portal they want to use.
You are a tough act to follow. So I echo everything about PKB. So our journey when we started this, we were really clear that our digital strategy, there's a really cool part around people enablement and patient enablement for digital data. So we're driven by making sure technology gets to the right people and it's being used in the right way, and people have access to their own data so they can make informed decisions about their care. And that includes our children and young people. So before we would allow any kind of deployment of a portal, we did some really interesting work with service users, and that required no one from PKB or the digital team going into these sessions so that we could truly understand what it was that they wanted from a patient portal. So we could understand what they thought a patient portal was and what the best use of where we needed to sort of target our work. And we were really surprised by some of the results. So appointments and letters were right up there, along with care plans, but also things like pathology results and medication information. And I think that's our next step. So we live with documents at the moment for children and young people. We're going live with documents, care plans, safety plans, diagnoses for our adults shortly. And we've just gone live today with pathology services. So we now have fully integrated order comms and results reporting in our EPR with our local labs. What that means is we can directly share all of our blood results and test results with our patients through PKB. So that will be our next step. And we're really excited about that, because then our patients will be able to share this information with GPs. They'll be able to share this with other professionals. They won't have repeated blood tests over and over again. We can manage things like clozapine levels much more easily, because it's not just inpatients that will get to benefit from this sort of innovation. Our community patients will be able to take our forms, our pathology forms, anywhere in their local area, and those results will come straight back to us. So we're not relying on GP services either, but we'll be able to share this directly back through PKB. And I think at the moment we've got around 13,500 patients that are registered. And the best thing for us is seeing that over 50% of those patients are logging in to PKB more than twice a month. So this means that engagement is there. They are really valuing why we've done this. And you can make the best decisions when you know the most about your own care in yourself. And being able to share that with family, being able to share that with other professionals. Like, again, I keep going back to children and young people because it's where we've done our biggest work. They can share that with their school teachers. They can share that with anyone that is involved within their care, and that's really powerful.
Thank you. We touched on it a little bit in a couple of the answers you've given around how you're using PKB and what you're excited about. But I think one of the things that I always get really excited about when I hear about your programs is actually how engaged your service users, your patients, their carers are. And I believe that that's because they don't just get a static view of information, they're actually a contributor, they're actually able to engage. And that's cool for me, that it's not a static system, it's a dynamic system. And Emily, I know that we've had lots of conversations about the benefits of actually engaging patients, and as you'll say, the proof is in the pudding, that they're logging in and they're using the platform and they see value in that. But I suppose from your points of view, with the programs you've done so far and where you're looking to go, where is the biggest potential in having that dynamic record for patients that they're able to contribute to? I know, Pam, you've got a bit of that with your beautiful flow that you've got with your questionnaires and your All About Me care song, but maybe you could talk us through that. I think it really shows how when you engage the patients and don't just give them something, you're asking for something back. It creates a full circle of engagement, doesn't it?
Yeah, so I think there's two parts to this question. So in terms of like the initial setup, in terms of like having the service user involved from the start, we had workshops with the service users, and that was really powerful because we had their voice from the start, and off in terms of co-designing it. But we also had, we can see her in the audience, Lizzie, I hope you don't mind giving you a shout out, but Lizzie was fantastic in being our community, so she works within the transformation team. So we had a transformation team that also helped support this with the digital team. They were fantastic in terms of like coordinating that and making sure that the patient's voice was heard throughout those workshops, and without that we wouldn't have had that voice from the start. And then in terms of like what we're doing with that engagement, it's been really positive. So working in a mental health trust, one of the key things is, and we had like we had a CQC report from the acute trust that said we can't see a mental health care plan, we're not visibly able to contribute to this patient. And by putting that care plan in the hands of the patient is really powerful, because it now means that that patient can take that care plan wherever they go. It's not just acute settings, but social settings. They can have conversations that are about them. And this is what's really unique about patient knowledge, and I absolutely loved it, is because it puts that power in the patient's hand. Now, being a clinical prescribing pharmacist, sometimes I'm blind and I don't have that information. This is my background before I worked in digital. But actually, when patients have that information, they have it at their hands, they carry their mobile devices with them, it's powerful. It means that they can sit and have conversations, and they can really direct that care around that patient so they get the best possible outcomes. In terms of doing the patient-reported outcome measures and doing it in advance, it means actually that they have the ability to be more honest. They can spend their time doing it, thinking about it. But also, it means when they go and meet with their clinician, that it's more effective use of time, so that clinician can really do a deep dive and give them the treatment that they need. And then also, because the app has different features that kind of support self-care, like when I go and see my doctor and I have 10 minutes in an appointment, I can't remember what symptoms I had. So the fact that they can pull that information in there about different symptoms that they've had, and they can really like navigate it around there, again, it means that it's more effective. It's their tool, they own it. So I think, yeah, it's really, really brilliant.
So quite similarly, I think when we think about that kind of static information, for me it's thinking about reasonable adjustments, and it's thinking about accessibility. So often we find when our patients end up in places like ED, they are already acutely unwell or in crisis and struggling, and trying to communicate their needs, their accessibility needs, or any kind of reasonable adjustments is near enough impossible. And actually the environments they end up in make their conditions in their presentation far worse. And sadly, the clinicians on the receiving end don't often understand why that is. And I always think back to when I was a patient and I was sat in ED and watching the triage process, and I was watching a woman who had a really young baby, and she didn't speak English, and she had to go to one desk to try and give her information. She was then asked to go to a second desk to repeat that information. She was then tried to be pulled in to be checked over, and she was refused to allow. She wasn't allowed to bring anyone in with her, so it was just meant to be her and the child, and she didn't speak English, and they refused to let anyone in. She had no way to communicate. And I sat there and I thought, I mean, that's appalling, full stop. What if that's a LD patient? What if that is a patient with serious mental illness that's in crisis? How are they meant to communicate what they need so that when they're going in, I mean, she was just told, it's your blood pressure, you don't need anyone to talk to you about that. And I thought, well, actually, no. What if you go into that room and something is said that triggers you? What if, you know, we have patients that maybe there are colours, sensory issues, that they go into a room and then they're overwhelmed and they have a meltdown. Having the ability to share this, to write this information into their own care plans, into PKB, means that they can share that directly. It makes that ease of communication better, and it should then reduce confrontations, violence, aggression, and give better care. And that's the drive that we're moving towards. We want to be able to make sure that accessibility piece, that ability to communicate someone's real needs, is able to be done.
Thank you. I've got one last question, and I'm hoping that our audience, because we've had a very captive audience here, thank you everyone for staying. The food's not even been touched, so this is all down to you guys. I'll open up to questions. So one last one from me. If we've got people here in the audience today that thinking this sounds great, but I'm nervous about getting going. I don't know where to start with this. What would you do to anyone that's thinking this sounds great, but how do I start this?
So I was in that position like when I joined the trust, and we came in and we were looking at different solutions on what we could do to share care plans, and honestly the one thing that I just did it. Like, I know it sounds mad, so if you can put together like a pilot, there's obviously difficulty in terms of funding, and you can go, right, we're going to pilot this and this is what we need, this is the need for it. I think this is probably one of the best solutions that we have put in that's enabled a lot of transformation. It's enabled people to have access to their letters, to their appointments, their care plans. And in terms of like the NHS strategy, it pays for itself. It actually pays for itself because when people are reading those letters and the quality of care, the solution will pay for itself. And I feel like if you want to think about it, reach out to us. More than happy to have conversations, because I did that. Like, I wasn't sure. I spoke to Breeder in the audience. She's brilliant. She's very positive, and she just gave me that reassurance that it's not just. Sometimes when you speak to suppliers, you think they're just selling you something. Well, actually, when you speak to the trusts and now have honest conversations with other organisations, I've talked to them, community healthcare trusts, various trusts across. And I'd never say something if I didn't think it was going to be of benefit to patients, because to me it's about, as an organisation, and what we're here to do is to deliver better patient care. So that's always in the heart of what I'm trying to do, and I think this solution really does do that. It gives people the ability to access their records. It is providing better healthcare. So I think definitely if you've got the ability to do it, more than happy to share, whether it's like we want to look at our functional spec, our IG bits, clinical safety, more than happy to kind of like to touch base and kind of share some of that learning. I know that like Brady did with us, she shared some of her journeys and the positives, also some of the challenges, because it's not easy, like there will be ups and downs, but actually when you learn from other organisations and go, well, we have this problem, but this is something that we're telling you so you don't have that same issue. But overall, it's been a really positive experience, and like I said, I don't feel like they're a supplier, I feel like they're part of us. I don't know what I'd do without Nikki. Like, Nikki's our project manager, but she's brilliant. So yeah, that's my advice.
And again, echo that if you want to reach out and have a conversation, then please do. I think I would always start by trying to understand the problem that you're trying to solve. So doing those patient engagement sessions, finding out from your service users what they think a patient portal is and what they're going to use it for is the only place that you can start. I think some of the work that we did as well was reminding clinicians that this isn't necessarily a tool for them. This is a patient-facing tool. This is for the service users. This isn't necessarily for us, and the benefits are going to be potentially more for the patient, but we'll see those benefits come back tenfold. Those are sort of my main things to start with. But again, it's, start with a pilot. There's the drive and the move forward in the NHS is to make sure we're into preventative care, that we're more in the community, and that we're empowering our patients. It can feel really nervous sometimes as a clinician around sharing data. For some reason, we seem to forget that this information isn't ours, this is the patient's information, and we have to trust that the patient can make decisions about their own care and empower them to do so. Keeping that mindset with you as you try and navigate some of the difficult challenges you might have around things like safeguarding, IG is really important, but there are processes and safeguards and all those sorts of things in place. Remember what the patient needs and how this can empower them. And I yesterday ended up walking in with Bobby, who was here to talk as a patient for someone who uses Patient Knows Best for her cancer journey. And I think what she said to me is going to stay with me for a long time. PKB, having a patient portal, having the ability to have her cancer care directly through to her phone to make decisions about what she needs to do next, made her feel like a queen. Her exact words, and that's why we do it, and that's why you should do it too.
Thank you. And I should have said at the beginning, I think congratulations are in order, because both of your trusts are up for awards, aren't they? So I think that's testament to all the hard work that you and your teams have done. So big well done. We'll keep everything crossed for you. as those awards are announced. But thank you so much. And has anyone got any questions?